People are on the highways. Thousands of people are on the highways with their families, and they should be able to depend on emergency services being available to them in their communities.
The emergency department at Carberry Health Centre is temporarily closed until further notice. Prairie Mountain Health announced on Friday that the interruption to emergency department services is due to staff shortages, which continue to impact healthcare throughout the province. More emergency departments in the Prairie Mountain Health region, as well as the Southern Health and Interlake Eastern Regional Health Authority, are also closed over the long weekend, and some for even longer. Mayor of the town of Carberry, Ray Muirhead, says they are in panic mode and they've been trying to secure a doctor for months.
Our last doctor was signed on for a 4-year term. He came out from Winnipeg, and his last day was yesterday.
Muirhead says they had another doctor who came out of retirement on a part-time basis, but she will be leaving at the end of September. The Carberry Health Centre is the closest hospital to the scene of the fatal collision that happened in June, taking the lives of 17 people.
It's because of that tragedy that this government should have been proactive in making sure that rural emergency services are open and available for rural Manitobans. Instead, this government did what it's always done. They've continued to cut health care, and they've failed rural Manitobans who depend on their health care.
CEO of Prairie Mountain Health, Brian Schoonbart, says individuals can call the health center to determine the nearest open emergency department, and all residents making 911 calls will be transported to the most appropriate open emergency department if required. Muirhead says they continue to work with surrounding communities to do the best they can, but he's concerned that if an emergency were to occur, the closest locations to seek services are Brandon and Neepawa, which are about 30 minutes away.
We're headed right to harvest season right away. So there's going to be lots of workers, farm workers, traffic, so on and so forth. And that's always cause for concern, at this time of year, at the best of times, let alone without a local doctor. So that's where we stand.
Muirhead says they're at the top of the list of getting a new doctor, but don't know when that will be. He says they are meeting with Prairie Mountain Health on Friday and hope to get some resolution. Prairie Mountain Health say they're continuing efforts to actively recruit staff to ensure the temporary suspension of services at sites are as short-lived as possible. In Winnipeg, Temi Olatunde, City News.